Thank you for coming. The reason we're at a church is because we did not have a projector anywhere else, so that's where we decided to come. And I'm a youth pastor, so that helps out that I have this wonderful place to do this at. So that's what we've been doing. The last year in Special Problems and now in Capstone Project, I have been studying Dr. Hagerty in his practice at Hagerty Family Dental. And Ms. Tisa is a stockholder in this particular dental practice, and she's here with me tonight, and I appreciate you being here. Thank you. The purpose of this study in this project, was to find any maybe problem areas or negative impact areas on your patients and how to solve those particular problems. The way I looked for the problems that I observed your practice for a few days, the only problem that I found was one where your patients could see the problem area in their mouth and be able to see a picture up on a screen somewhere and say, yeah, that looks pretty bad, or yeah, that probably needs to be filled, or that probably needs a crown, or whatever you think is the best problem, and the problem area. And I believe that was the biggest problem I found. The research methods that I used were, we met with each other, we talked about the things of what you think would be needed at the practice, and this was the one thing we came to the conclusion that was needed the most was maybe an intraoral camera. And the way I did that was I asked a questionnaire to your employees to see if that particular camera would help your practice. Next. I did that by giving a questionnaire, and the questions were, how often in the past 6 months has it been difficult for you to show the patient his or her problem area? The next question was, how difficult was it to get them to accept the treatment plan? The next question, do you believe that the intraoral camera could have benefited you during these times? The next question says this, how great is the need for the intraoral camera? The last question I asked was, how difficult would it be for you to train you and your staff on this particular instrument? And the answers was this. 10 or more times in the past 6 months, and a few times it was difficult for the patient to accept the problem because the treatment plan, because you did not have them able to see the particular plan, the problem area. They all answered yes. They believed that the intraoral camera would have helped them in these particular times. All your employees said yes. And they all said that it would be pretty easy for them to pick up on the intraoral camera. Next. My recommendations on this particular problem is to buy the intraoral camera. It will allow your patients to feel at ease, and it'll allow them to be able to see the problem area and more likely to receive the treatment plans. And as the equipment it's not that hard to use either. Next. The criteria for recommendation was this. How urgent is it? How soon could you have one in your office the day you bought it? So you could be starting using it tomorrow if you decided to buy one. Next. The cost, how much would the camera cost you? I researched it anywhere from $100 to $1,200, and it depends on which one you want. There's nicer ones. There's some that are not so nice, but still get the job done. Whichever one you and your practice feel like is the most beneficial to you at that time. Feasibility, how useful would the camera be in your practice? Will it make a difference? I believe that it will give your patients the peace of mind that they need, and it will be more likely for them to receive the treatment. And I also believe that it will give you the ability to show them and say, hey, this is exactly what I need to do, and it will give the doctor, Dr. Hagerty, a lot more ease and say a lot less stress on him, because patients can be mean and upset about X amount of dollars, just say a crown or whatever, because I know some stuff costs a lot of money. If they've seen what it could lead to in the future, the pictures show them what could happen further on, and what is the problem in their mouth right now. It helped them receive the treatment plan. Next, the equipment needed. As I observed, you have three things that you need, and you already have two of them. You have a laptop already that you have in the office, and you already have a USB port. The only thing that you would need to purchase is the camera itself, the inshore camera, and you could do that tomorrow if you wanted to. You could order it online, or you could go to a dental store and order that now. And the last thing is just buy it. I think that it will help improve the quality especially the quality of your instruments. And you know, this office has a lot of different little toys that you can use. It's another one that you could help use and help you benefit your practice and help you be able to just give your patients the peace of mind that they need. I appreciate your time. Thank you very much.